In this video, let us find out how to safely clean our ear at home. Namaste. I am Dr. Divya Badaniadir. I am an ENT specialist working with Pristyn Care, Bengaluru. Do you feel your ears are getting blocked up? If so, you might have an impacted earwax. Earwax or cerumen is a self-cleaning agent which is produced by the ear canal. It traps dirt, bacteria and other debris. It normally comes out by itself because of movements of the jaw. Most of the times, the earwax is soft and liquidy. In some patients, it is a bit flaky and dry. If it tends to accumulate over time, it can get hard. Some patients end up using earbuds and can cause the wax to get impacted. Now, what are the problems of an impacted earwax? It can cause pain or feeling of fullness in the ear. There may be a mild earache. There may be mild ringing sound in the ear. Patients can feel that they're not able to hear comfortably. Rarely, there may be cough. How to clean the earwax at home? You will notice that most ENT doctors say to never use something smaller than your elbow inside the ear. This is true. Do not use any earbuds, Q-tips, bobby pins or hair clips to clean the ear. You can use a damp washcloth to clean the outside of the ear. If you must use a earbud, use it only in the outside of the ear canal. What are we supposed to avoid when cleaning the ear? Never ever use a earbud deep inside the ear. You may cause the wax to get impacted further. This can cause significant pain and discomfort and hearing loss. Unfortunately, most patients can also end up damaging their eardrum. Do not use sharp objects like bobby pins or hair clips. Do not go for ear candling services. The fire from the ear candle can injure the ear. Never attempt to irrigate your ears by yourself. It can cause infections or rarely eardrum perforations. You can use a softener. You can use a wax softener which is available over the counter. You can apply this multiple times a day for a week and then visit the ENT specialist to get your wax removed. How is the earwax removed? Visit your ENT doctor. The doctor will look inside the ear using either a microscope, an endoscope or an otoscope to confirm the presence of earwax. Wax can be removed by using an instrument known as a curette. It can also be removed by syringing or by suctioning. When should you meet an ENT doctor? If you find that the ear block is persistent and does not reduce by these simple at-home remedies, please visit the ENT doctor. Whether you have ear pain or not, it is a good idea to meet with your ENT specialist once a year so that you can get your ears, nose and throat examined. I hope this video has been informative. If you have any questions, please write to us down below. Thank you.
Book your appointment on pristyncare.com. Pristyn Care.